to ask our Academy coaches to kick us off.
There's 3 of us, so we'll just jump in. Welcome everyone. Thank you for doing this. I'm Jennifer Suss. I'm the Academy coach at the Academies of Racine Horlick High School. And I am also here with 2 of my cohorts that I work with on a daily basis.
Hi, I'm Carrie Morey. I'm the Academy coach at the Academies of Racine Case.
And Paul Hennessy, I'm the Academy coach at the Academies of Racine Park.
Thank you for being part of this panel. All 3 of us would tell you on a regular basis, we get requests from our students who really want insight as to what the health world is looking like right now. And due to this whole COVID thing, thank you for being part of it and letting us into your world the best that we can do virtually. I know that we are going to start out with having everybody introduce themselves to the students and for everyone else who's here.
Do we want to start with the ambassadors if you want to introduce yourselves, and then we can move on to each of the panelists?
Sounds good.
Hi, I'm Preet. I'm a senior and I'm in the biomedical sciences pathway at the Academy of Racine Case.
I am Haley and I am a senior as well in the Academies of Racine Case in the Health Sciences Academy.
Hi, I'm Elizabeth Hansen, and I'm from Horlick High School, and I'm a senior there as well. And I'm also in the biomedical pathway.
Thank you. We're going to have our other panelists. We do have representatives here from Ascension, Advocate Aurora, and from Gateway Technical College. So I'm going to start at my top of my screen, and I'm going to start with Tony.
Hi, I'm Tony McCrae. I'm the laboratory supervisor at Kenosha Hospital. Nice to see you.
Thank you. And then I see Bob next.
Hi, my name is Bob Formanek. I'm an instructor at a place called Gateway Technical College, and I teach in the medical assistant program.
And then Morgan.
Hi, I'm Morgan Kaiser. I'm the director of simulation and skills here at Gateway Technical College. So that's really where our nursing students get all their hands-on skills experience. And I myself am a registered nurse.
And Amy.
My name is Amy Ryuda. I am a clinical coordinator for the School of Health Programs at Gateway Technical College. I'm also a lab assistant for the PTA program and a proud graduate of the PTA program here at Gateway. Thank you.
And Mark.
Good morning. My name is Mark Lefno. I'm with Advocate Aurora. I'm a pharmacist in administration, and I am a proud Case grad.
Yay! And Holly.
Good morning. I'm Holly Landerman. I'm a registered nurse at Ascension All Saints in Racine here. I've been a nurse for 30 years, 28 of it, 27 about, here at All Saints in Racine, and I'm currently the stroke coordinator at the hospital.
And I'm scrolling through, and Linda.
I'm Linda Erickson. I am a radiographer, an X-ray technologist, and also an instructor. I'm one of the clinical instructors of the Ascension All Saints School of Radiologic Technology.
Thank you. Okay, so next we will start with some questions. Sorry, coaches, I kind of just took over there, right?
Sorry, we have a couple more introductions too, though.
Yes.
We're missing.
Oh yes, our graduates. Yes, our graduates.
Destiny, do you want to talk, or Jaden?
There you go. The two. Yes.
I guess I can start first. Hello, everyone. My name is Jaden Vaughn. I'm a first year at New York University, or NYU. My major is social and cultural analysis with a minor in biology on a pre-med track.
Hi, everyone. I'm Isabel Bueller. I am currently a freshman at the University of Wisconsin-La Crosse, majoring in biomedical sciences with a minor in chemistry, and I'm also on the pre-med track.
And we do have one more panelist. I totally apologize. I have so many faces on my screen right now. I cannot keep up.
We have one more student too, sorry.
I know, I'm all over the place, sorry.
Hi, my name is Destiny Ocasio. I am a freshman at UW Oshkosh. I am majoring in kinesiology, and then I'm a graduate from CASE.
Thank you. And then Laura.
Hello, everybody. I'm surprised you missed me with the blue hair, but my name is Dr. Laura Catherine Neal. I'm the Associate Dean for the School of Health at Gateway Technical College. And I was brought onto the panel because I have spent 20 plus years working in healthcare at the executive level as either a practice administrator, a chief financial officer, or the chief information and operations officer for a hospital. So I have a lot of experience in the administrative side of healthcare, both in private practice and the hospital. And then I also have several degrees, but one of them that's really primary for healthcare is a master's in public health, which has been very influential in the pandemic.
Thank you, thank you. Okay, we got everybody. I have 18 faces on the screen, so that's why I got confused. And sometimes they move. It's really weird. Okay, and here comes my morning train. So there it goes. Sorry, Jennifer, Paul, Carrie, do you want to have our moderators start?
Sure, I think we were going to start with Gapri asking the first question, right?
Yes. All right. So can you guys describe the path you took or are taking towards your current career?
Start with me like we did before. My degree is, I have a bachelor's degree in what they called at the time medical technology. Now it's called clinical laboratory science. And it's a 4-year degree. I received my degree at University of Wisconsin in Milwaukee. I started out working in the laboratory, actually in Racine at All Saints, and was a bench technologist there on second shift. What we call a generalist, meaning I worked in all areas of the laboratory: hematology, coagulation, chemistry, blood bank, micro, the whole gamut. I did that for a few years and then became the lead in that position, which I also did for a few more years when I moved into a supervisory position there. And did that for quite a few years and decided I was looking for something different and moved over here to Aurora, Advocate Aurora, in mainly Kenosha, but oversaw point of care testing at this hospital, our hospital in Burlington, and our hospital in Lakeland. And that was completely different because I worked out of the lab, but I didn't work in the lab. I worked with all of the team members outside of the lab that were performing point of care laboratory testing. So that was really interesting. And I did that for a while and got kind of lonely for the lab. And it just so happened that this particular supervisor position opened up, and it was a really, really good fit for me. So I moved back into the laboratory. And that's how I came to where I am now.
Do we want to try and just move in the same order?
Everybody
for
shifted on
introduction?
me, but I can go
Sure.
next if you'd like.
Yeah.
As I mentioned, I am Amy Ryuta. I work for Gateway Technical College, but I am also a proud graduate of the PTA program. And I've been a PTA for 16 years, so my career path is long. But it started out in high school. Both my parents had worked in the local hospital system, and I was so impressed by what they both did at the hospital that in my mind at the time, I wanted to be a nurse. So I got a job at a nursing home and worked weekends shaving all the old men in the nursing home and accompanying them to their doctor's appointments. And then I became a CNA. So I got my certification to be a CNA. And I was doing so well at that, apparently, that I got promoted to the rehab department in the nursing home that I worked at. Here is where I got to work with patients, work with their exercises, helping them with pain and their mobility. And when I was working with them, I just fell in love with the patients I worked with. And I had all these therapists saying, you should really go to school for this. You would be very good at it. And that is exactly what I ended up doing. I love my degree as a PTA. I have an associate degree in applied science, and it's given me so many opportunities as a PTA. I started out as a new grad working with oncology, and I worked in inpatient and outpatient settings. I did some home care for a while. I went back to nursing homes and helped in the nursing home setting, and was again promoted to a manager. So I managed a rehab team, which was really exciting and rewarding. And then to have it all come back full circle and to get a job where everything started for me at Gateway has just been truly an honor. I am so proud of being a PTA and where it's brought me. So thank you.
And why don't we have Mark go next?
Sure. When I graduated from CASE, I was really a fan of the math and sciences throughout school. And looking at the healthcare fields, trying to identify where I might be able to apply those activities, I really started looking into pharmacy. I went to Drake University in Des Moines, Iowa, and was able to go through a direct admit 6-year program. And I graduated with a doctorate in pharmacy, and I started practicing as a pharmacist on the retail side with Aurora Pharmacy. And I did that for 4 or 5 years, and subsequently became a supervisor, and subsequently became a manager and entered the administration of pharmacy. I now oversee 15 of our retail pharmacies, overseeing the south side of the Wisconsin territory.
And Holly.
Good morning. So in high school, I really wasn't sure what I wanted to do, as I'm sure many of you have that same feeling right now. But I happened to be talking to the father of the children that I babysat for, and I was thinking, should I be a paramedic or an EMT? And he's like, well, why stop there? Why don't you try being a nurse? And I'm like, well, that's interesting. So I actually attended Fox Valley Technical College in Appleton, similar to Gateway College here, and completed my nursing degree in 2 years. At that time, you were able to go directly through summers. I really enjoyed the technical college area. I became a nurse initially on a cardiac unit for about 3 years. And then my husband's job brought us down here to this area. So I have been received a job in the intensive care unit here at All Saints. And I worked there 24 and a half years on night shift, and about a half year on day shift before I became the stroke coordinator here at the hospital. Throughout that time, I had many different charge nurse roles. I attended different alerts in the hospital. And then obviously my nursing career grew as the time went on. And now I'm on my 31st year of being a nurse. So thank you, and move on to the next.
Yeah, Linda, if you would like to go.
Hi, I worked for an orthopedic surgeon, two orthopedic surgeons when I was in high school as secretary file clerk, and they had a radiology, a lady that did x-rays in the office a few times a week. So I would help her, assist her, watch her. She was a really great mentor. And I thought, oh, this is neat. I would like to go to school for this. And at the time it was only 2 years. It was most of the programs in the state were 2-year hospital-based programs. And I thought, oh, that would be neat. It would be a quick clinical study, and then I could just start making money right away. And that is what happened. It was great. I ended up going to Milwaukee, to a hospital in Milwaukee that had a program, not even knowing that Racine had a few. So since then, that was a long time ago. Since then, not only has the field blossomed, there's all kinds of things that you can go into from general radiography, just basically taking x-rays. And, you know, you've probably heard of MRI, CAT scan, sonography, nuclear medicine. These are all branches of this profession. And I was able to do a lot of those things on my path. And then I finally landed in teaching, in education, because since 2015, the profession has advanced so that you need a minimum of an associate's degree to sit for the registry, to sit for the boards. And so they've actually, you know, kind of, the profession has moved up in what you need to be a basic radiographer. And so our hospital provides the 2 years of clinical training that go with your basis. If you have an associate's degree, you can come to our program, and, you know, associate's degree with the prereqs. And, or if you are we are affiliated with several colleges now. And so I went on, after doing cool stuff like mammography and CT, I finally got to be a clinical instructor and went on to get my master's degree in adult education. And so now I am a clinical instructor and I teach didactic classes here at the hospital. And we also, and then I supervise the students in the clinical portion of it on the floor, working with patients every day. And I love it. I found my niche. It's been 27 years that I've been in education and I really enjoy it. And now some of my earlier students are now my colleagues, and one of them was even my boss for a while. So it's been a ride and I love it. And the profession has changed, but in my opinion, all for the better.
What I'm gonna do next, a suggestion, we do only have an hour, and I know we had a lot of pre-submitted questions, and I know our moderators are ready to ask those. I am going to actually have our Gateway people hold on for their questions, so we can move through, because we have a total of 8, and there are questions coming up for my Gateway fellow colleagues here. So if we want to go on to the next.
All right, so the next question is, what is your favorite part about your job/college program?
Well, starting with me again, I would say my favorite part is being able to help the physicians diagnose the problems with their patients and then help them. Prior to becoming a laboratory science, I actually worked in the retail field and found that although I liked to help people, I didn't necessarily want to be with them one-on-one. So being in the laboratory and being able to contribute to the good health of a patient, but not working with them one-on-one like a physical therapist or a nurse or a physician or PA would, this really became my niche. It's also a field where things are changing constantly. It's very fast-paced. There's really not a lot of downtime, and I like to stay busy, and it makes the day go by fast. And when you leave, you really feel like I contribute something positive. Thanks.
If anybody else wants to jump in, I'm just going to open it up for whoever would like to jump in for that question.
I can jump in next. From a pharmacy perspective, one of the things that I really find engaging about pharmacy is that there's multiple areas within pharmacy. There's retail pharmacy, there's inpatient pharmacy, there's nuclear pharmacy, there's industry pharmacy. And a single degree allowed me to have the ability to open doors into any one of those fields. And one of the things that really intrigued me was if there was ever a point in time where I felt that I got stuck in my career, I always had the opportunity to fall back onto some of those other areas inside of that profession. I've now been a pharmacist for just over 20 years, and I've never ventured away from the retail pharmacy setting because I've really found that the abilities that I have in direct patient care is more than just dispensing medications, but it's also administering vaccines. It's providing hands-on diagnostics. It's training and teaching. It's being a drug expert and really helping to identify the best therapies that our patients can get the most out of their medications.
I'd like to say that many people compare and say that radiology is an art and a science. And I can echo what Mark and Tony said about enjoying being part of a diagnostic team, that you're helping find the patients, find what's wrong with the patient, or how we can help them, and having limited but very essential patient contact and education, which is what pharmacy is all about. Radiology is you're understanding how to take the best images and how to make them diagnostically ideal, and working with the radiologists, understanding what they need to know and what they're looking for. And sometimes the patients can't be in the ideal situations, the ideal positions. So then you have to kind of work your skills and magic to come up with the best imaging opportunities. And that's where the art comes in, and to be proud of what you're putting forth. And that I enjoy that part of and working with the patient, but still with the radiologist and with all the healthcare team in the hospital.
I guess I just want to jump back in and agree with Linda and Mark that, a lot of times people think science is just science, but it's not. There really is so much creativeness that goes along with it, because things don't always work the way they're supposed to. As a matter of fact, in the medical field, they very often don't work the way they're supposed to. And you have to be innovative and be able to think outside the box. And then just to reiterate what Mark said, this particular degree that I have, you can get an associate's degree, a 2-year degree, or a 4-year degree, or a master's degree. And it would place you in all different situations. If you're happy with really just working in the laboratory, a 2-year degree would be fine. If you wanted to do something a little bit different, definitely a bachelor's degree. But yeah, there's, working in the laboratory, working with in research, working with the manufacturers that we purchase our equipment from as application specialists. Many of the people that I've worked with in the past, because we have such an extensive, what's the word I'm looking for, computer system now for patients, patient records. Many of them have branched off into IT situations. There's just, like what Mark said, I never did either, but I always knew that if I got tired of doing this, there were any number of things that I could do, and the demand for us is so high. It really is. And the pay's not bad either. Thanks.
Do any of our recent graduates want to touch on that question at all? What do you like about the programs that you're in right now?
I think I can speak first on that. I think from a graduate, first year freshman, some of the programs, I think it's just really finding people that you can relate to because you're all in something new. You're all not really sure if this is what you're planning on doing your full 4 years. You're going back to school, doing other things. So I think being able to relate to other students, making those connections with professors, just kind of getting the feel of what you're going to be doing is something that's really enjoyable, making those new connections and those relationships.
Yeah, I also have to agree with what Destiny said, and also kind of going off of that, it just seems like I have a lot more freedom in the courses that I take. And so in high school where you're kind of oh yeah, I'm not really interested in history, or I'm not really interested in a tech course. They're important classes, don't get me wrong. But for me, they just didn't really pique my interest. But now, going to college and having to pick courses that I actually enjoy, which are very much STEM related, I just feel like I'm really motivated to learn and really excited and love it, honestly.
Yeah, I can agree as well. I think finally getting into the courses that are pertaining to what I want to do in life are really interesting to me, and it makes it kind of fun to go to the library and be there for long hours looking at those textbooks and reading about those things and learning. It's just really motivating to kind of see those things come to light and realize that this is actually what I want to do with my life, and these courses are going to help me get there. So
I think one thing that really helped me in my schooling at a technical college was that first semester I was already doing clinicals. So I had that hands-on right away to help me make sure and assure that this was the right path that I wanted to take, which was really good, especially since I didn't, work in any type of healthcare setting, and my family was not in any medical setting. I really wanted to assure that this was something that I wanted to continue down that path. So, that's one thing I always recommend, that if you're kind of interested in medical, somehow get in within a hospital system, or like Linda worked in a doctor's office, because then you can, even if it's not a medical role, in dietary or, there's so many different roles that you can take. Even in pharmacy, there's a pharmacy tech. My son's in a pharmacy program right now. There's a technician job that in retail or even in the hospital. And, that way you can kind of get to see the whole thing and figure out if this is maybe what you might want to do.
Should we move on to the next question?
Sure. Okay. What are some of your biggest challenges associated with your job or college programs, such as are there differences between each position that would make it more difficult to change?
I can jump into that. From a pharmacy perspective, there's lots of different medications that are used on an inpatient basis versus an outpatient basis. Likewise, I spoke of nuclear medicine earlier. That's a whole separate specialty that really looks at the half-life of the radiographics that you're utilizing and time of administration. While it is definitely possible to jump from one side of pharmacy to another side of pharmacy, there's definitely a education piece to make sure that you brush up on between one area to another. Not a negative by any means. There's lots of exposure across the board. However, there's definitely some things you need to brush up on.
I can kind of speak to, I always think that once you're done with school, your learning will be done. But even after 30 years in nursing, you're still learning because technology advances, science advances, there's new science out there that says something's a little better. So you'll always have that actually desire to learn more. You want to know more, and never be afraid of asking questions, because I'm always a little leery of the people that don't ask the questions, because you know, there's no dumb questions. You really want to be asking those questions so that you feel comfortable.
I would say the biggest challenges from like a college program standpoint, you know, having all of my courses revolve around STEM, it can get a little bit stressful, I guess, because it's very time consuming with things like I'm doing homework, lecture, studying, revising, lab reports, like it's a lot of stuff at times. So just making sure that like I'm on top of everything, I'm turning in everything on time, I'm going to tests and lectures and making sure I understand material is probably the biggest thing. And like Holly was saying, asking questions and making sure that you understand the material is so important, because that's what TAs and professors are for. They're there to teach you. So that's kind of like the biggest thing. That's a challenge.
And then I think jumping off of kind of what Jaden and Holly both said, like with the asking questions and it getting stressful, I think the biggest thing is also allowing yourself to keep pushing, even though things are getting hard. Because I think it's so easy to think just like, I can give up right now. I can start letting myself go, not turning in things on time, not keeping up the consistency. And so I think I can just piggyback off of that, making sure you're reaching out, having the resources that you need and the support that you need, because that's what everything is there for.
I think I can just let you guys know that those programs are very challenging, all of them, and it's to ensure that you're successful when you do graduate, because the learning doesn't stop. It's not like, phew, I'm done with school now. You know, there's generally certifications or licensure or other types of things that are necessary once you graduate, and it's just a constant learning phase. And, you know, if you find when you're in your programs that you don't like that, then stop, because it's going to be like that forever. You have to be one of those type of people that wants to learn more all the time.
At this time, I think we have 20 minutes left, and I want to make sure we get all of our panelists able to share what they have for their subject matter expertise. So can we have our moderators switch to more of the programming and gateway offerings so we can get those questions addressed? And then we've been answering some of the questions in Q&A. So all students that are in the attendee list, make sure that you're reviewing those, because we are answering those as we go. And we do have a couple more in there waiting to be answered. So let's switch a little bit and start asking more questions regarding Gateway and programming and college degrees and programs.
Okay, so what kinds of programs are available at Gateway?
So I guess since I'm the Associate Dean of Health, I probably should answer that question. So I did answer in the chat kind of an overview of just the programmatic titles. We have a full nursing program with classes running at the Kenosha, Racine, Burlington campuses, and we have skills labs that Morgan and her team runs really effectively in all of those locations. We have nursing assisting, and Amy already talked about her CNA experience, so we definitely have a very strong CNA program that also works in all of the academies as well. We do a lot of that in the academy level for each of the high schools. We have physical therapy assisting, which Amy talked about because she's a graduate from that. Bob has talked about his experience in the medical assisting program. We also have surgical technology, where students can learn to be OR technicians working in surgeries in the operating room. We have pharmacy technology, so Mark would be really happy about that because we have Pharm Tech as a full-blown program in our Burlington campus. Our Surg Tech programs in Kenosha, physical therapy assistings in Kenosha, medical assistings at all of our campuses. We have health information technology for those who are interested in the medical records, coding, billing, those types of aspects of the healthcare industry. We have that's actually an online program. And we also have dental assisting. That's also in the Kenosha program where students can learn how to be dental assistants. And then we have a partnership program with MATC for students who graduate from the dental assisting program who have an interest in dental hygiene. They can take our dental assisting program and then move into the MATC dental hygiene program. We also have a shared program in ophthalmology tech for those who want to work in the eye industry and in eye care, that we partner with LTC for that program, and that's actually run out of the Racine campus. So we have a lot of diversity here at Gateway in terms of programs from that technical college aspect that can really get you jobs in field in 2 years or less. Many of our programs are either certificate, diploma, or an associate's degree, depending upon the track you want to take. And most of them have some type of a clinical aspect or practicum where you go out and work in field. Many of our partners are on this call as panelists, where our students actually attend and actually go to Aurora and Frederick and Ascension and a lot of other local pharmacies and things like that, where students go and actually get practical experience before you sit for your certification. And then many of our partners convert our students from internship or practicum to employees. Most of our students get an offer, whether it's through the internship, practicum, or that clinical experience. So that's been really great as well in terms of what we can provide. There's a supplemental question that's in the Q&A that's also, that was kind of talked about in terms of like, what are the best fields to go in? And I would support Holly's answer, which is really good, but it's really about just what are you passionate about? Because healthcare is a field that's diversifying, that's constantly growing. Tony and Mark and Holly have all talked about that in terms of where the field's going. In my experience, I started out as a technical coder for Blue Cross Blue Shield, writing the code that creates the medical records. So I started out a very long time ago in the electronic medical record side of the house before it became a thing, and then worked my way through managing medical practices, managing hospitals, managing clinical trial organizations. And there's a lot of diversity in terms of where you can go. So the first thing I always recommend for students is, what do you enjoy? What are you interested in? Do you like that face-to-face contact like Holly talks about and Morgan's talked about with nursing and Bob has talked about with medical assisting? Or do you like to be a part of the process but not have that constant day-to-day interaction like you would in the lab, like Tony talked about? Or are you very technically minded? Do you like the computer side of it, the networking side, the coding side of it? And then health information or coding may be a thing for you. And as many of you, and especially the college students, have talked about STEM as a part of your curriculum and kind of found your niche in terms of what works for you from a STEM perspective, that really can bleed into where you can go in healthcare. There's so much diversity across the board: private practice, working for large organizations, working for, urgent care centers, emergency rooms. It's across the gamut. And many of us here at Gateway have had pretty diverse experience, not just in where we started. Amy's a great example. She started out as CNA and then she went to PT. We typically don't see a connection between the two of those, right? We don't see that. And I started out pre-med and ended up running hospitals as the financial officer. So it's amazing the journey that most healthcare employees have taken in their careers. And if you have an opportunity to sit down and chit chat with anyone who's worked in field or even retired from field, and they share their journey of how they went from point A to point B, I think you'll find that there's so much opportunity out there that if you find something that you super enjoy and you're really interested in, there's a job in healthcare tied to that. And it's not hard to find. And you should reach out to your instructors, your teachers, your guidance counselors, people in your family who are in these fields, and just use them as resources to kind of help you decide what's the right path for you moving forward.
Yeah, and Bob, I just wanted to interject because I think, our colleagues or our partners here at Aurora and Ascension and even Frederick will tell students right now that medical assistant is actually one of the fields that is has a shortage, not just nursing, not just CNA, not just all of the other fields, but we have really heard from our hospital partners and our healthcare industry partners that medical assistant is actually a good choice at this time So with these students that are listening today, they are sophomores, and what kind of programming they are getting in their pathway courses at RUSD, I think will lend very, very nicely to the medical assistant. Do you want to talk about that program just a little bit, Bob?
Sure. So let me kind of share with you a couple of thoughts. To those of you that don't even know what medical assistants are, they're people that work in healthcare. Basically, they work closely with the healthcare providers. So the doctors, the PAs, the nurse practitioners, and they do a lot of the basic things that are expected, taking vital signs on patients, doing a lot of the procedures that assist the providers doing the care. All of the clinics in the areas, hire medical assistants. The medical assistant program is what is called a technical diploma program. So that's basically a one-year program. At Gateway, it's 3 semesters. So it's the kind of thing where a student can come in, get out, and get a job, very quickly. When the students are in high school, I know that most of the high schools offer medical terminology. So like if they end up taking the medical terminology class at the high schools, that will transfer into the program. I think human body or anatomy, if some of the high schools offer that, that would transfer into our program. And with the demand right now, yes, there's a lot of, how should I say, growth in healthcare, and it's an entry-level position. So a lot of times people will go into it, they don't stay really long, and they kind of move into something else. So that kind of supplies, a steady stream for jobs. But, I think a really nice thing for the high school students to know is that it's an entry-level kind of thing. Like the other panelists were saying, if you have an interest in helping people, a willingness to learn, it's a great place to start. And like Dr. Neal was saying, we offer it at all our programs. So all our campuses. So Racine, Kenosha, Walworth County, Elkhorn, you can do the program anywhere. And a lot of our courses are online. So that gives the students a lot of flexibility too. So it's it is a great high demand right now.
Yeah, and Morgan, I know I'm kind of taking over. It's because I'm very particular about the time right now. And sorry, everyone. But Morgan, maybe even so what we've normally done is we've taken this sophomore class to our simulation center. Obviously at Inspire, we are not able to do that this year. This was our best way to get some experience to the sophomores right now, but we will, there was the videos that they could have watched. But Morgan, if you want to just really quickly talk about the hands-on that they do in that simulation.
Great. And we are called Gateway Technical College because we really do focus on those like technical hands-on skills. And I'm really proud to work in our lab. And when I was a nurse working on the floor, I could definitely tell when I worked with Gateway nursing students because their hands-on skills were so strong. And now working here, I can see why. And we really focus on our lab experience for our students. So in our nursing program, particularly, your very first semester, you're exposed, you have a skills class where you really get to do everything hands-on. You learn how to use your stethoscope. We have mannequins that have heart sounds and lung sounds. So you really get to feel and experience what it's going to be like when you're in the field. So we have clinical and skills all the way through our program. So as Sarah was mentioning, we have our simulation lab. So that is where we have these high fidelity mannequins that can blink, they have pulses, you can code them and do CPR on them. So we really program them to mimic different kinds of patient experiences that you would get in the hospital. So we let our students through every semester experience what it is like in the simulation lab so they can know and have confidence when they take care of a real patient. So for example, we have a birthing simulator. She can give birth to a baby. Our students can work through that and know what it feels like and be able to ask questions. And then we can do it all over again and they can gain that confidence. So when they go to the hospital setting, they can feel more confident in taking care of a mother in that circumstance. I did see one of the questions in the chat about like, how do I know what field I want to go into nursing, or there's so many different specialties. We teach across the lifespan. So all the way from babies to elderly. So you get experience through your clinical settings, as well as here, like we have baby simulators and we can change our adult simulators to a geriatric simulator. So you can know what it's like in all those different categories.
And lastly, I want to be able to have Amy really quick talk about her role in PTA program, but also, which I call it the cadaver table, but you guys have a fancy name for it.
Hermitage.
Yeah, Laura can say it. I can't. So Amy and Laura, if you want to, because I know, Amy, you do a great job when we're in person on really demonstrating that table. And I always close my eyes because I can't look at it. But if you want to talk about that program as well.
Sure. And Laura and Morgan, please jump in if I'm forgetting any important parts about the anatomage table. I love playing with the anatomage table, and I love having students come for school tours to come and look at it. It is a really cool interactive device that we use where you can see an entire cadaver in a 3D digital image. And what's nice about that is we bring a lot of our PTA students into the classroom, and they can see how different muscles and bones and everything kind of line up, throughout the human body. So it kind of takes you out of that textbook sort of, that's the only view you can see. And it can really give you a really cool 3D image of what you might be studying at that point. So, and it shows all different kinds of things, like different systems, like the nervous system, cardiovascular system. Again, if you're learning about bones and muscles, you can kind of isolate what you're looking at and learn a lot about whatever that topic may be. And what's also really nice about it is interactive. So it's not just me standing up and talking. People can come and play with the table and look at it. Or there's little quizzes and things that you can do with the classes to just kind of do some group activities. And it's a really cool thing for us to use for our students. I'm really glad that we have that for them.
Thank you. And that does tie to PTA, obviously, the physical therapy that and that's another question we've gotten in the past. And then there's one more we'll answer here in Q&A is physical therapy. What is the demand for physical therapists? What is their college level courses? And what is the difference between that and a physical therapy assistant?
Okay, so a physical therapist is someone who goes to school a little bit longer than a physical therapist assistant does. Physical therapists tend to obtain their doctorate degrees right now. And really the difference between a PTA and a PT is the physical therapist is the one that will meet the patient for the very first time. They do all the tests and assessments to see what we can do to help the patient the best. So the physical therapist then prescribes a plan of care. It may be massage and exercises, maybe different types of equipment that we may use in the clinic. Then what may happen is this plan of care in this patient may be passed off to the physical therapist assistant. The physical therapist assistant then follows through with that plan of care, and there is a lot of communication between the PTA and the physical therapist. They are your supervisor, so you need to have that constant communication with them. But it's great to kind of work together, and it is just amazing to see people sometimes at their worst with injuries, or they've had, a diagnosis that's kind of turned their world upside down. It's great to work with people kind of when they're at their lowest, and to watch them progress and get things back that we take for granted is just truly rewarding. So whether you're a PT or a PTA, I think we all get into the field just because of that. We really love our patients and we want to see them get better.
Thank you, everyone. Really quick here, we have a few more minutes. I'm going to really quickly ask the last question here in Q&A. Are radiation therapists still in demand? And is it common what kind of schooling they need? I know that we have an event that we're trying to set up with Ascension coming up, I think in April. I think coaches, you're working with them on radiology activity. So hopefully we can go into that. But does anybody want to take that question? The radiation therapist, is that still in demand? And what kind of degree would you need?
Well, this is Linda. I'm part of the radiology school, and radiation therapy is an addition. Now it is a branch, I would say, of radiography. And indeed, some of our students go on after their Bachelor of Science in X-ray, in radiography. They go on to be a radiation therapist. There is a demand. There seems to always be a demand in all of the radiology areas. We only have 6 students at a time, and generally they all get jobs within the year that they graduate. And so radiation therapy, though, is an extension, and it would require a different path, another certification, another 2 years. You would have to have your bachelor's degree in radiation therapy. And there are a few colleges with that course in Wisconsin.
Thank you, Linda.
It would be
And
additional.
one last thing before we finish up with our last question that is on our list. I know we did not get to all of them, but we are running out of time. I just wanted to point out, thank you, Mark, for making the statement. The students cannot see what Mark had suggested, but thank you to Autumn. You'll see her on the screen. She's our interpreter. Mark has pointed out that medical interpretation, I just lost the word. Interpretation is a very key role, even in the health industry, and that how the healthcare providers rely on interpreters to help them through medical care. So thank you, Autumn. And so our last question, I think we have it all mapped out and ready to go.
All right, so the last question would be directed to the college students. Advice to your younger self.
I can, oh, you can go.
Me, you.
Yep, you're good.
Okay.
You got it.
I think the only thing that I would really tell my younger self, being like you guys sophomores that are listening, I think just like getting your foot in the door and gaining as much experience as you can while you're in high school, because then I think it would give you a broader overview on what to expect when you get to college or whatever you plan to do with your future. So I think like attending these seminars, going to different events that are being held, just making sure that you're absorbing as much experience as you can before you get into the real world.
I completely agree with what Destiny had to say. Getting those experiences is really crucial for kind of figuring out what you want to do. But also I would say keep an open mind, 100%. Having one solid idea of what you want to go into in the future when you get into college isn't always the best idea. There are so many majors and there are so many concentrations within a major. There are so many certificates and stuff that you can gain within college that really having an open mind allows you to see those ideas and kind of maybe take a different career path. And it's a really good idea to just keep your mind open to those things because they are all out there for you to look at.
Yeah, and I second both of what they were saying. I would say my biggest piece of advice for myself would probably be just learn what works best for you. It's so easy to be in college surrounded by other college students that like you kind of hone down on yourself and you think that you're not good enough because everyone else is smarter, but you gotta kind of have to just let that go. And so, just know what works best for you, whether it's studying, learning, managing stress, really just anything. You just got to learn that on your own, and that's unfortunate, but I know that everyone can do that, so.
All right, well, thank you everyone so much for being here today. I know we didn't get a chance to answer all of the questions, but I think we addressed the fact that you are at the sophomore level, and the goal of the academies is to expose you to all these different opportunities for the next 3 years. So hopefully by the time you graduate, you'll have more questions, but then also more answers. So thank you for our panelists who were here today as well. We really appreciate all of your insight as well.
And again, thank you to Mark and Tony and Holly and Morgan and Amy and Laura, Linda, all of you and all of our students. This took a lot to put together. It was a lot of logistics. I have to say this was my first webinar that I've hosted, so I think we all did very good. Thank you, Bob, as well. I'm trying to look at on my screen here. So I'm going to stop recording. Students can log off unless you have one last question in the Q&A, but I think we covered most of it. And then we look forward here at Gateway of also answering any questions for the Academies of Racine Pathway students. Thank you.